For those of you who don't know me, my name is Matt Lanphier with the Colorado Department of Healthcare Policy and Financing. I am the Managed Care Technology Unit Supervisor here at the department. Our unit is responsible for managing the eConsult platform contract, which I will be presenting on today. I am joined by my colleague, Emily Wessner, who is the eConsult contract administrator. I know we've gone over the introduction, so I won't spend a whole lot of time on this. And then I'm also joined by our partners at SafetyNet Connect, Teresa Lynn and Heather Steele, who will also be presenting. Next slide, please. Meeting agenda. All right. A brief overview of our agenda. So I'll be providing some quick highlights of the platform. We'll talk briefly about reimbursement and provider compensation. And then I'm going to hand it over to my colleagues at SafetyNet Connect, who will talk a little bit about their specialty network, talk a little bit about where we are with the platform. And then the most exciting part, I think, for most folks is they will provide a demo of the platform for us. And then they will also provide some information on how to participate with the platform. Next slide, please. So a brief overview or a few highlights. For those of you who are unaware, our platform went live on February 1st of this year. The platform is a tool that provides asynchronous or store and forward communications between a PCMP or primary care medical provider and a specialty provider. This platform is free to all Health First Colorado providers at coloradomedicaid-econsult.com. And then I also want to just add that while this presentation is focused on the eConsult platform, we've also opened a fee-for-service benefit for eConsult, and providers are allowed to use third-party platforms, for providers that have their own platforms, for instance, as well as the platform offered by the state. So it's not necessarily an either-or proposition for providers. If there's utility in using the state's platform as well as an existing platform, providers are certainly able to do that if they so please. And then lastly, just want to note that single sign-on capability is available and offered for free to all providers, or at least some version of single sign-on capability, I should say, with most electronic health records. And yeah. Also want to talk briefly about compensation. The department has opened CPT code 99452 for use by treating practitioners or PCMPs. All PCMPs rendering services, whether via our platform or via a third-party platform, will submit claims for completed e-consults to the department for fee-for-service reimbursement. The rates for those are, and then consulting practitioners or specialty providers who use our platform, the Colorado Medicaid eConsult.com, will be compensated directly by our vendor, SNC. And the rates for those will be $17 on the PCMP side, approximately, and then approximately $35 on the specialty provider side. A completed e-consult includes a clinical question, a response from a specialist, and then closure or sign-off by the PCMP. And next slide, please, to go into a little bit more detail on the best practices around coding and that 99452 code on the PCMP side specifically. This side, I think, summarizes the requirements for submitting that code a little bit more explicitly. So the billing practitioner must be a licensed MD, DO, NP, or PA. Verbal consent must be documented in the patient's medical record for each consultation, including the reason for the request. Documentation of signed off consultation must be in the patient's medical record. And then there's a time component to that as well. I think, the 1/2 + 1 of 30 minutes. So greater than 60 minutes spent on interprofessional consultation, which includes the preparation of the consult, the review of the guidance, and then the communication with the patient as well. Next slide, please. I also want to touch briefly on FQHC and RHC or federally qualified health centers and rural health center reimbursement. As some of you may be aware, our FQHCs and RHCs are paid, somewhat differently than other providers. They're paid what's called a PPS rate, which is a prospective rate, and as opposed to a fee for service. And there's a whole lot that goes into that. And I'm not necessarily I'm not necessarily expert on FQHC billing policy, but there have been some questions about whether or not this would be paid fee for service as sort of a carve out to that rate, or whether it would be built into their prospective service rate. And I want to clarify that it is not carved out separately. Costs associated with services provided for eConsult visits through an FQHC RAC are considered allowable costs for their cost report. And so those cost reports are ultimately what goes into building the rates. So, we are encouraging the use of the eConsult for FQHCs and RACs to show utilization, and include that in their cost report before the annual cost rate reviews, so that ultimately those will be built into their prospective rates. For any additional questions on that, please feel free to use this email address we have here, and we'll be happy to direct it to the appropriate folks and get you an answer. And this email address is for anything related to eConsult as well. So. I think that's it on my side. So I think what I'll do now is I will hand it over to I think Heather will take over from here from SafetyNet Connect, and then we'll save some time for Q&A at the end.
Great, thanks, Matt. I appreciate it so much. As I mentioned, my name is Heather Steele. I am the Provider Relations Manager at SafetyNet Connect. And just to give you a little bit of understanding about our experience around eConsults, throughout the country, we have worked closely with public health plans, correctional facilities, community health partners, as well as the vulnerable and underserved population. We do have quite a bit of experience and have completed over 10 million eConsults, or reached about 10 million patients through our partnerships. And we have just quite a big list of partnerships acting as a vendor for the technology space of eConsults. So when we're looking at increasing access to specialty care, that's really what this is all about. And that's what eConsult provides. Specifically, it minimizes the gaps in areas with limited availability to specialty care. This includes urban, rural, and frontier communities. It does provide support in managing members with chronic health conditions for primary care providers. It also decreases long wait times to see a specialist in person, because a lot of the less acute conditions can be managed by the primary care provider through the eConsult. And it also does improve access for members with social determinants of health-related barriers. So actually, when we're talking about Colorado Medicaid eConsult, it is an asynchronous or store and forward clinical communication, as Matt mentioned. And it does use a web-based platform. So anybody that has access to the internet can access the Colorado Medicaid eConsult secure platform. Essentially, when a patient is visiting with a provider, the provider may have a question about next steps in care that would require a specialist advice. So he or she can log into the platform and submit a clinical question. The specialist can then review that submission and close the eConsult by providing clinical guidance. This happens within 3 business days. The PCMP will then review that clinical guidance and the recommendation and then sign off on the eConsult. And then finally, the primary care provider will schedule a follow-up with the patient to go over that plan of care. So it's a very simple process. Just want to kind of go through who's involved in the eConsult process on the primary care medical provider side. The provider is the one that's actually asking the clinical question. So as you noted, Matt, on the billing piece, the MD, DO, NP, or PA is the billing practitioner. They're also the ones submitting the eConsult for review by the specialist and then reviewing that recommendation and signing off on the eConsult. The staff can really support this process as well, though. We know that in primary care medicine, there is a team-based level of care, right? That's how this happens in primary care and how it's so successful. The staff members can actually initiate an eConsult on behalf of their provider, including finding the patient, selecting the diagnosis codes, as well as uploading any supporting documents such as labs, progress notes, or test results. They'll then save that information as a draft, and the primary care provider can then pick it up in their work list, ask the clinical question, and submit the eConsult for review by a specialist. Organization administrators within the practice are able to utilize access to utilization reports, and they can also reassign eConsults in the clinic if needed. They also are the ones that will be working on the submittal of claims to HCPF for reimbursement for those that submit claims in a fee-for-service manner. I did want to provide you with a little progress update about the eConsult platform. As Matt mentioned, it went live on 2/1. And currently we have 31 primary care medical provider practice sites that are live in the platform. We have trained 84 providers. That includes MDs, DOs, nurse practitioners, and PAs. We've also trained 16 primary care medical provider sites have completed enrollment and are waiting for onboarding. And 6 of our RAE partners have been trained as region admins. 22 staff users have completed training, and 14 org admins have also completed training. So we're off to a really good start with those early adopters on the eConsult platform, and we're just excited to continue to progress. Real quickly to let you know about what are the available specialties for eConsult. We have a broad and deep bench for eConsults for the adult services, 21 available specialties all the way from addiction medicine to urology. And then in the pediatric space, we have 13 available specialties for eConsults, and we're still recruiting just a few of those pediatric specialists as well to complete that bench, as they say, for the pediatric patient. Specialists who are interested in participating is encouraged. We're trying to build a Colorado-based specialty network. And so if you are a provider that is enrolled or willing to enroll as a Colorado Medicaid provider, and you're licensed to practice in the state of Colorado, and you have a unique interest in sharing your expertise with PCPs, you're a really good fit for being a specialist on the platform. So if you do have any interest, please reach out to us at coloradosupport@safetynetconnect.com, and we will connect you with our specialty network partner, ConfirmMed, regarding the contracting, credentialing, and training process. We want to provide a quick case study example from the platform that we have received since go live. This is for pediatric dermatology. And this provider sent over an eConsult for a 3-year-old male who was injured and had an on his right eye, and then developed a rash that began spreading. Normally, this would have been a pediatric dermatology referral, but they utilized the eConsult platform to just get confirmation of the diagnosis, as well as alternative treatments to the treatment option that the PCP recommended based on just a fear of lack of availability for that current medication. One thing to note is that the provider did upload photos of the rash so that the dermatologist could then take a close look at what was going on with the patient and have a complete level of guidance to provide. The pediatric dermatologist responded on this consult within 1 business day, confirming the diagnosis, but also offering diagnostic clues and education if the PCP were to see this type of presentation in the future. So giving some of that information, as well as a link to a great patient resource that he or she uses with patients that may have this condition. That obviously is helpful with the parent being able to explain to them, the severity and the treatment plan for this condition. The specialist reviewer also then talks about the treatment plan and then does provide some alternatives, as well as even a follow-up if that first bout of treatment is unsuccessful. I do want to let you know that this provider closed the eConsult as PCNP management and sent this guidance back to the primary care provider. What PCNP management means in the Colorado Colorado Medicaid eConsult platform is that the primary care provider can then take those next steps in care with the patient, and there's no need for this provider to refer the patient to dermatology at the time. So you can imagine how successful that was for the patient and the provider alike. At this time, I'm going to go into the demo, but I did want to pause for some questions if there are any. And those can be directed at myself or or at HCPF.
As a non-provider, just a community member, I kind of like the fact that you all you need is internet access, which means you just be able can access, such as I'm doing right now using Chrome. And are you finding that of your 31 PCMPs, are they on some type of explicit platform, or are they just coming in through the internet, like through Chrome or some other web access that is more generic?
Good question, Rich. Yeah, so far, everybody has been trained to access the website using the website version. But we have begun exploration with single sign-on and have had a few practices that are moving towards a single sign-on capability, which means they can access the Colorado Medicaid eConsult platform directly from their EMR. And that's just working with their technical resource and making sure that their EHR has that capability. And then our technical team helps make that connection. So we have had instances of both, but the ease of utilizing the web-based platform, does allow for flexibility and versatility for virtually everybody.
Yeah, I would think that would be so important to make it as easy as you can. And Heather or the team, are you finding that those providers, those primary care providers, are also on other e-platforms, e-consult platforms, and are using this one as kind of an adjunct to them? Or are some of them, this is their first e-consult platform? What do you think?
So far, our practices are new to eConsult that have come on board. So the concept and the platform is the only one that they're using, but they certainly could use it as an adjunct if they're already currently utilizing a platform. And that could be for the reasons that they want to do it specifically for their Medicaid population because of the ease of the search engine, or it could be because they might have an available specialty that they might not have in their current platform. So either way, we're versatile.
Well, that's good to know. I know we just kind of on the side with some of the folks we're talking about. If you already have an e-consult platform, would you want to use this one? But what you're saying is you're really, so far, it's been folks who don't have an e-consult platform. So it'd be interesting to see with those who are already using one, such as the one at School of Medicine has, how would that fit? Would work with, how would that work with this one, or how would providers work? Having a couple or at least another e-consult platform, would it be confusing for them? And I guess time will tell as we have more people come into the HCPF eConsult platform.
Yeah, we definitely encourage folks to just explore it and see if it's right for them.
I was just going to hop in too. That was a great question, Rich, because I was just thinking, because as you guys know, we've chatted about this in advance, there's some Aurora-based folks that have certain access to certain e-consults, but there's other clinics that don't. And there's some specialties available through this platform that aren't available through the other one. And I'm not sure if actually pediatrics is on there too. And so it just makes me think how there could be a really good opportunity also to message to some of the sites that might already be using that one platform to maybe get on both so that they can just get access, utilize all the resources available to get patients access and reduce kind of those unnecessary visits to in-person. So it's just a broad concept, and it makes me think outreach to those might be helpful. And that's good to know that if they needed to use different resources, that's okay.
Yeah, for sure.
I'm wondering, you mentioned pediatrics. I was thinking in terms of adult, but you have an explicit pediatric platform. I wonder what the other eConsult platforms have. Are they focused much on children, or is it primarily adults? Do you know, Carrie, or anybody?
I need to look. I feel like the one that some of the Aurora ones are on through the School of Medicine focuses more on adults, and that children's hospital, and we try to, like, I take care of kids, right? Like if I need help with kiddos, that's more urgent. We use their one call, which is like kind of an in-person voice consult through the state, but I'm not sure that I've ever done an e-consult with kids, but that would be super
I
helpful.
can follow up with the Children's Hospital about that. Just from personal experience, a lot of the pediatric clinics are on the MyChart or the electronic medical record. So I know that my kids have done had e-consults within that going straight to children's, but I'm not sure for other clinics. So I'm sure that they would be able to provide a list of the clinic or the practices that are on their MyChart.
Oh, yeah. Well, I guess I was going to say along those lines, because thank you guys so much for coming, because it just makes me think of how can we help you guys get this program to where it needs to go in Aurora, and how can we use our connections for that, for everyone on the call. And oh yeah, going back to kind of that data slide, do you have a sense of, were you able to see how many in Aurora might already be on it? Or are we kind of, because there's also some other access in Aurora, as we know, folks have not initiated from the Aurora space to join the platform yet?
Yeah, I did do some research, and it looks like we have not yet had any practices from Aurora engage with us. So again, why we're excited to be part of this as well, to get the word out to your communities and your primary care provider clinics.
Okay, great. That's good.
Yeah.
My question comment is, I love the case study example that made it so real for me. I don't know if anyone could see, I was leaning in, trying to like pretend I was a provider, trying to figure out what to do. I'm not a true crime like podcast person, but I think there could be a case for case study podcast to really build up the eConsult world. Just throwing that out there if ever anyone has any extra time, because I was certainly leaning in during the case study.
That's great. Yeah, I mean, I think that is, that's where you as a clinician, it gets your wheels turning, as where would I utilize this? And we're hopeful that it's at any time that a provider feels like, should I be sending this patient to a specialist? And before they do that, asking the question, right? Asking a question. Because it does oftentimes result in the specialist being able to provide that guidance. And so the PCP can then follow up. In that specific case, it makes me think about if the patient, as the family is waiting to get in to dermatology, like just, the angst I would have as a parent waiting for that. And instead of that happening, the PCP was able to, just feel confident in the medications, also have additional options, feel confident in that diagnosis without the referral.
Certainly like demonstrates the confidence that a provider would have having success like that. So thank you.
Yeah, sure.
Demo time.
Okay, great. So you're seeing the landing page of the Colorado Medicaid eConsult platform. You can see here that we have a notification section at the top, which allows the primary care provider to quickly see what adult and pediatric specialties are available. And then the message inbox section is really where the communication is happening between the primary care provider and the specialist. Really simple. To order a new eConsult, you'll simply click on New eConsult up in the green ribbon. And then you'll go ahead and search for patients that are eligible Medicaid members. And you can do that either by last name and date of birth, like I'm doing here in the demo, or if you have that patient's Medicaid ID, you can go ahead and do that. So one feature of the platform is that you do not have to create any patients in here. Instead, you're searching for eligible members. And then you'll go ahead and hit search. And then you'll be presented with a list of patients that meet your search criteria. In order to begin that eConsult, you'll simply hit select. Under the eligible column, you'll decide what specialty type you're looking for, adult or pediatric. And then you'll go ahead and choose your specialty. Your referring site is available here. If you practice in multiple locations, you can select where you are seeing this particular patient, or if you're just at one clinic site, that will be defaulted to that site. And then you go ahead and hit next. Now you're brought into the consult request screen. This is the patient's information section. And then scrolling down, you'll see that we have included a required checkbox regarding the member consent. So as Matt mentioned, for billing purposes, consent is required from the member regarding eConsult, and this is outlined in the telemedicine billing manual. So the primary care provider or staff member will document that the patient has consented to the eConsult here. And then scrolling down, you'll see the provider's information. If you're a staff member that's initiating an eConsult on behalf of a provider, you'll have a list of providers here in your clinic, so you can select the appropriate provider. And then really the consult information. So this is the meat of the eConsult, beginning with the dynamic ICD-10 diagnosis lookup. So you can just begin typing in your diagnosis or suspected diagnosis and click add, and that will add it in. One diagnosis code is required for submitting an eConsult, but you can add up to 5 diagnosis codes in the platform in order to just inform the eConsult. Next, we move on to the specialist reviewer section. And this is where you are either selecting your specialist directly, or you're just opting for the next available specialist in the round robin. So clicking on the drop-down next to specialist reviewer, you're able to see a list of specialists that are either Colorado-based or national network specialists, and they will be labeled that way in the heading. And just by directly selecting that provider, you now have the provider profile popped up here, where we encourage our specialists to add a little bit more information about themselves in the provider profile, so that the primary care provider can just begin to develop that rapport with the specialist. Moving on, we're now into the clinical question. And when we're in training, we do train the providers on the ability for them to use templates, but they do not have to use templates if they don't want to. For training or for the demo purposes today, I will go ahead and use a pre-populated eConsult clinical question. Essentially, the specialist just wants to know a little bit about the patient, the chief complaint, any medications that have been tried and utilized, any treatments, and then if there are easy lab tests to put in here as far as results, you can certainly do that, but you also can upload those documents as well. In this clinical question, we're asking for additional medication options. So that's the most important thing, is that the primary care provider needs to ask a clinical question based on the information that they're providing. As I mentioned, they can attach additional documentation such as current labs, images, results, photos, or progress notes. And they can also assign their staff to do this task on their behalf. So we do teach the primary care providers and the staff members how to work together in the platform to make this as easy and streamlined as possible. At the bottom of the page, before submitting the eConsult for review by the specialist, the PCP will want to acknowledge if there's any substance use disorder related information. So this is really important for protecting patients under 42 CFR Part 2. And if there is any SUD information included in the consult or the notes, they will want to check this checkbox so that notifies the specialist there's SUD information contained in the eConsult, and they actually acknowledge and break the glass to view the contents of the eConsult. So really a great benefit that HCPF had us develop here just to protect those patients and from the confidentiality space. There's always an option to save this as a draft. As primary care providers, we know how busy things can get, and you often get pulled away. And so you can always save this as a draft and come back to it later to submit. Or if you're ready to submit it, you can go ahead and submit it for review by a specialist. So you do that just by clicking submit. And now you have a few options. You can go to your inbox, start a new consult, or go to your My eConsults and manage your work lists. Just cruising back to the landing page, what's happening on the back end is the specialist is being notified that they have an eConsult that needs their attention. They will populate their guidance and oftentimes reply with a recommendation and close the eConsult with that recommendation. Once that happens, the primary care provider will be notified via email that they have an eConsult that is reply in their inbox. And so then they'll be prompted to log into the system in order to review that guidance and sign off on the eConsult. So I have just pre-populated an eConsult here for us to review. You can see that when the primary care provider signs in, that they will see the entirety of the guidance in their inbox, but they do have an option to look further into the dialogue by clicking on the dialogue button, which will give them access to what their clinical question was, as well as the guidance, and any attachments that the primary or the specialist might have included as well. The last step for the primary care provider will be to acknowledge that they've reviewed this information, similar to when a PCP gets any clinical notes from a face-to-face visit with a specialist. They have to sign off on those notes in their EMR. Here, you're just acknowledging that you've reviewed this information, and then you're signing off on it by just clicking the blue checkbox. You can do that at several places within the platform, inside the dialogue tab, in the eConsult detail tab, which we go through in detail during our training sessions. Once you click the checkbox, it will just confirm that this is the action that you want to take. And then you just click OK. And then an optional survey will pop up. This really just helps us and HCPF better understand the ease of use of the platform, as well as just assess if this eConsult is meeting the provider's clinical needs. And so they can answer this information if they so choose, and then go ahead and submit that information to be collected. So that's just a really brief overview of the system, but obviously training is a lot more comprehensive than that. The last thing I just want to share with you is that when a provider is done training, or any user, they always have access to our user guides and info section. So this is where they can download any of our written user guides, as well as training videos that we have placed in the platform for refresher. So this may not be something that they utilize every day, and they might hop into the system and try to think, how do I do that? And so they can quickly access those training documents right from the platform. Any questions about the platform itself?
Heather, staff, like medical assistants, how much of that, of the getting the consult into the system could be assigned to them? Maybe with the provider just providing the questions that he or she needs to have answered. Can that provider then just turn it over to the medical assistant to do the rest, to submit it?
Yeah, there is definitely a few different workflows that the staff member can do to support eConsults for their provider. They can actually do the initiation of the eConsult by clicking on the new eConsult button, starting the eConsult, finding the patient, adding the diagnosis codes. They do not see the box of the clinical question, so they cannot ask the clinical question, nor do they have the opportunity to submit an eConsult. So at the bottom of their screen, they have submit for review. And so they can add those labs or progress notes or images, whatever is the provider has guided them to do so. And then they'll submit that for review by their provider. Their provider will then come into the platform. They'll be notified that they have an eConsult draft that needs their attention. The PCP will then come into the platform, and they'll go ahead and grab their eConsult in their My eConsult section. They have a drafts work list that they can then access that eConsult, and then they will ask the clinical question. If they'd like to select a specialist, they do so, and then they submit the consult. So it definitely can cut down on the time for the primary care provider in completing the eConsult itself. They can also choose, as the PCP starts the process, and then they feel like, I want to upload quite a bit of documentation, but I don't have the capacity to do this. They can then assign their staff member to do that on their behalf. And all the notifications back and forth are coming through email for both the provider and the staff member. So everyone's being notified that they have some action they need to take inside the system. They don't have to guess. I guess that's really important.
Thank you. Go ahead.
Yeah, I was just going to say, I was wondering about the task list, and that's nice. You basically already answered that question. And Rich, I think something that's that I've recently learned in the past few years through prior work with Dawn is like state regulation allows MAs to be trained in whatever scope their supervising provider kind of trains them in. And so I think that's a really nice scope of work flexibility for our state, such that MAs who have really been able to kind of train in a specialty, or for instance, being able to collect the appropriate labs, that can be so helpful. And so I think that's something really nice that can be leveraged for this platform. I had another question. Oh, one thing that's always like a barrier, I think, is the step between eConsult and like one simple question that can be returned versus it's a little too complex and you need a little back and forth in order to bridge a patient to, or at least a little bit of discussion back and forth to either complete that so the patient doesn't need to see an in-person provider, or get some advice like that that's not urgent while the patient is maybe waiting for an in-person visit, which could be 6 to 9 months out. And so can you share a little bit about, I know that there is an opportunity to do a little bit of back and forth, but like in one of those examples, it said, oh, I recommend some labs as a next step before a face-to-face. Sometimes are the specialists writing back and saying, I recommend labs, and then reinitiate an eConsult again once you have the answer and we can take it another step? Or what is that looking like? Or is it just only things that require a one-time back and forth that are allowed?
Oh yeah, great question. So there's a few different scenarios here. If a primary care provider has submitted some information and the specialist has a follow-up question, so maybe they're thinking about the next question, or they would like to look at a specific lab that might not have been uploaded or something, they have the ability to keep that eConsult in dialogue and not close the eConsult. So from the specialist side, if they need more information, they can request it. On the primary care side, if they feel like they need a follow-up to whatever the recommendation was. So let's use your example. So they say, order lab X and get the results, and then let me know, what the results were. If that is the case, the specialist is probably closing, instead of PCNP management, they're probably closing as further workup recommended. So they're just letting them know, these are the next steps I think you should take, and then let's talk again. In that case, the primary care provider can resubmit the consult with a new question. So once they get the labs, they can essentially attach the old eConsult with a new one with those lab results. And then the specialist has all the information when they get the new clinical question. Does that help answer your question?
Yeah, and then is each kind of encounter billed as a new encounter?
Yes.
That's great.
Any other questions about that? I did want to just be able to make sure we get to the how to participate section in our presentation, because there could be folks that look at this and they say, oh, I'm ready, let's do it. I hope so anyways. That is kind of what I just wanted to make sure that we concluded with, but I do want to make sure that I've answered everybody's questions.
Carrie, how does this appear to you? You're experienced with eConsults. For me, again, being a non-provider, it seems so simple, and I know it's not. But with the other systems that are out there, does this seem like it's more streamlined and more easy to access than others, or what do you think?
Every system has its strengths and challenges. What I love about this, it looks simple. Not like I'm commenting on you guys' system. It looks great. it looks simple and straightforward. I think it's really great that it just looks very provider friendly. Like you guys, this was, you can tell you've been doing this a long time. It's very provider facing, with the idea of being able to have team members participate in that to make it happen, since right now these are really happening outside of the context of visits usually, and so it's in your magic time as a primary care provider. And so the ability to have others help, and I really like that there's an option to go back and forth a little bit, because I feel like that is an area where innovation is needed for kind of those. It's not that many questions you have to figure out how to manage that patient. The one hard part is inherent to the fact that like it's an outside system sometimes because we don't have a state electronic health record. If we did, it could be really integrated, but it's, and so I get that it's nice that the only hard part, which is a practical part about that, is you have to take attachments from one health record potentially and put it into another. But I don't know that there's maybe one day somebody will design something that like an AI that connects all health records.
Right.
So this is
never know.
exciting.
It could definitely happen. Well, we appreciate the feedback, and that's definitely the feedback that we've gotten from the primary care providers, is that this just seems really easy to use, and very user friendly. It shouldn't be intimidating, right? The goal is for you to be able to get in and get out and get the information that you need from the specialist, and then take the next step. So I think that's really important. If you have folks that are ready to participate, they can begin the process by emailing us at coloradosupport@safetynetconnect.com to begin that process. Also very simple and straightforward. We are enrolling practices and based on their information, and then they'll let us know what users they want in the system. They'll complete those forms. We'll validate them against the file that we get from HCPF, and then we'll confirm enrollment. Finally, the practices will train. So that will be whatever user role that they would like. And we're also flexible. Like, we had a practice that trained all the providers, and in the middle of the training, I got an email from the organization admin saying, we want to make sure we train our staff members because they saw the value of that. So now I'm training the staff. So it's not like a one and done either. We're here as this is a continuous process. Training is required for everyone to use the platform, but we do have a lot of flexibility in what that training looks like. So we're offering live interactive web-based training sessions weekly by user role. And we also have self-paced video training options for those that cannot attend a live session. As I mentioned, once they get into the platform and they're live, they do have access to the written user guides, as well as those self-paced training videos just directly through the platform. And then once their training is complete, we're marking their participation, and we'll send their login credentials via email so they can log in that day, the day they complete training, and order an eConsult. We're also here if providers hop in and they feel a little bit intimidated by what do I do? I did complete training, but I still want a little extra support. So we're happy to hop on what we call a virtual side-by-side for that few minutes with the provider to help them complete their first eConsult. So we're really here to support the process. We want to make sure that everyone feels just comfortable. And sometimes that takes just that first time, right? And then they know how to use it, and they know how to access it, and then they're good to go. So we're here to support through that too. So I know that, Rich, I think you send out the PDF of this slide deck to your community members. We have included the link to the practice enrollment form for those folks who might view this or are on today and you're ready to get started. You can actually just submit your enrollment form, and that will get you started in the process. If you're interested but want to learn a little bit more, we do have our program overview webinars offered on the first Fridays of the month. And so our next one is tomorrow, or this Friday at 12:15, and the registration link is here. And then we're also here if there are additional questions or specific workflows that you want to discuss with with us to kind of work through. You're envisioning, this is how I'd like it to look. We want to help you through that process. And so we're happy to connect with you one-on-one as well. And if you'd like to do that, just email us and we'll get together on a call to learn more about what your needs are.
I just wanted to ask you, I know it's only been a few months. Do you know if providers are billing for the services? Because I know I've heard before, some of the practices just want the help. The reimbursement isn't as big a deal. So I was just wondering if HCPF has shared, if providers are billing for using the platform.
Yeah, that would be a question for HCPF. So I'll punt that one over to Matt and Emily.
Yes, it's a little hard to tease out this early just because it is so new, and there are difficulties in teasing out like who's billing for using the platform and who's billing otherwise. But yes, we are, and just because we haven't done that analysis, not because it's particularly hard to differentiate the two. But yes, we have seen folks bill, I think at last, and folks were sort of already billing for this in the first place, because this is a Medicare reimbursed service. So, you know, we do get Medicare crossover claims, and so those come to us. And so so folks we've always been receiving claims for this code. It just hasn't been open for a long time. So we have been receiving quite a few. As to how many are particular to the benefit or the use of this particular platform, I think we have yet to do that analysis, but we have seen, I'll just say several hundred come through since the benefit was launched in February.
Okay, thank you.
Yep.
Any other last questions? I know we're coming up against the hour. I didn't know if you had anything else, or if I just punt it back over to you, Rich and Mandy, for closing.
Well, I was one of the most profound slides in that demo for me, again, as a community member, I think is slide 9, which simply points out specialty care, increasing access, minimize the gaps where specialty care is limited, rural and frontier communities, and I'm afraid in urban communities too. It's a struggle to get specialty care, as I'm finding out. Support for those with chronic health conditions, decrease long wait times, increase access for members with social determinants of health problems. And I would think that all providers need, before they make that referral in person to a specialty care, we need to encourage them to think, now, wait a minute, I know I'm busy, I have a ton of stuff to do, but just to write out a referral that's going to take, like Carrie says, 7 to 9 months for that person to get in to see a specialist. Is there something that I can do now? And maybe go ahead and write out the referral 9 months down the road, or impossible. But in the meantime, initiate an eConsult to see, indeed, is there something that primary care provider can do right now to help that patient, and have that kind of the protocol of primary care folks to engage in. Again, it's simple for me. For a primary care provider like Carrie and some of the others, it's not that simple. But wouldn't it be great if that's what they thought first before rewriting that referral, or in tandem with that referral? Let me do a special consult on this. I want to know if there's something more that I can do. Those are kind of my thoughts on that. And yeah, I think this is just a wonderful program. I really congratulate and appreciate HCPF and Safety Net Connect and the folks, other folks, for being on top of this and now working this into our protocols for healthcare. Any other thoughts?
Yeah, this is great. And I think I'm excited. I think a big thing I had coming to this was learning a little more about it and understanding how I can help. And so I hope everybody on this call has ideas around that, and whoever you're connected to, you can go back and share so that the patients who need it get connected to it. So I'll be chatting with folks in my role as I kind of continue to meet with folks to see if there's other practices that should really be getting online to make sure that they're maximizing connecting our patients with the resources they need.
Thank you all. See you at the next meeting.
Thank you for having us today.
Yeah, thanks so much for coming.
Bye.
Bye, everybody.